10,000 Canadian doctors and nurses with licenses along the Canada-US border, in those states along the border. Tell us a little bit, like, where are most of these cases happening?
Yeah, the majority of those cases are happening in Ontario. About 6,600 are in Ontario. And that's likely because they have those really dense population centers right along the border: Windsor, Detroit, and then Niagara Falls, Buffalo. But this is happening throughout other parts of the country. Commuting is also fairly likely in southern BC. Abbotsford is right along the Washington border, and there's about 900 healthcare workers in who have a BC mailing address and a license to work in one of those U.S. border states. So those are the areas where the commute is most likely. Now, it is important to note that we can't know for sure. I mean, some of these nurses and doctors might have moved. They might have just gotten a license and are considering a move, or they might have moved back home to Canada at some point. But one thing that is also important to note is it's not easy to get a license to work in the US, right? There's a lot of paperwork you have to fill out, and it can be a little pricey as well. It's at least $450 US. So it's not something that the average healthcare worker would just do on a whim. They're actively considering working in the US.
Now, I know with the case of Michigan nurses, how many of those are not Michigan nurses, Ontario nurses who are commuting to Michigan? How many of those are actually doing the commute versus maybe they're retired or they're thinking about doing it?
Yeah, that's about 63% who are actively commuting, and about 8% of them are planning to either move or commute in the future. So add that up, that's about 70%. That's a significant chunk.
Now, I know you've been reaching out to some other states that no doubt have attracted a lot of healthcare workers: Texas, California, Florida. I look forward to seeing what kind of numbers you dig up there. I want to shift gears and just ask you about the solution side of things. Let's imagine that tomorrow that you're made the Minister of Health in any province, let's say it's Saskatchewan. What do you do to maybe convince some of these workers to come back or stay in the first place? Any thoughts on that?
Yeah, I mean, for one, I would take into consideration the feedback that we got when we surveyed some of these nurses. Intuitively, you think, oh, the number one reason they're leaving is because of money, but that's actually not the case. The number one reason was availability of work. So you think to yourself, wait, there's a staff shortage and these healthcare workers can't find a job? Well, it's not that they can't find a job at all. It's that they're not being offered full-time work. A lot are finding it difficult to get anything other than a part-time job with strange scheduling where they have to deal with swing shifts, or they have to get a second job to get enough hours to provide for their family. And that's something that a lot of them have just found they don't have to deal with in the U.S. They're welcome there and can easily get full-time work. So I would certainly take that into consideration. Maybe try to work with the unions to fix that scheduling issue. And I'd also look forward to I would go forward more with promoting partnerships with privately run, publicly funded clinics. As many provinces have started to do so already. That just offers more choice for healthcare workers in an environment that they might prefer to the government-run system.
Okay, and then just final question. Are there any stories that stick out in your mind? I know you've been picking up the phone and talking with some of these nurses who were doing this. Any stories or comments that they provided to you that stand out?
Yeah, one thing that really stuck out to me, we went down to Windsor, Ontario, and we spoke with a woman named Cheryl Cassio. She's lived in Ontario and worked in Michigan for about 30 years. In that time, she's had to deal with crossing the border daily through 9/11 and the COVID pandemic. Some really tough times where border security is something that's not easy to deal with. And she prefers working in the US so much that neither of those got her to even consider staying to work in Canada. So it just kind of shows that when nurses have that option, a lot of the time they think the grass is a lot greener down in the US.